keep eating or whatever you want to do, whatever, but there's a time crunch. I have to, well, first of all, somebody's going to be in this room at 1:30. So, and I kind of want some questions, and answers. Okay, so thanks for coming. This is mainly about the work that I've been doing since I retired. I retired as the Bureau Director about 15 years ago. Prior to that, I had co-authored the book that you all saw earlier. Okay, co-authored it with the clinical psychologist. It has a mind, body, spirit book, focus, and which is hard in this society. People that don't know what they're fed a lot of on the evening news. And the good news is, I've been pleased to see that revolution. That there's more and more health advice, starting with Oprah. People were doing whatever Oprah said. Now they know whatever Dr. Oz said. But now we have a Dr. Phil who's trying to bring in the emotional health. But that's important because they're all separate. Okay? So I always talk about here, you have the health center on one corner, you have the physical health on one corner, you have the mental health on another corner, and you have the church way over here. And never the twain shall meet. Okay? Except health centers, once again, have been revolutionary. There are a number of health centers that have implemented prayer in their health centers. They have prayer rooms in their health centers. I mean, again, they're on the cutting edge of the need to deal and emotional health they've had for a long time, co-location of emotional mental health services, realizing that people, because of stigma, will come to the psychiatrist in a primary care setting, and their neighbors don't know they're going to see the psychiatrist. Especially that was true in the rural health area. And there were some health centers where they dealt with the stigma by having a book truck. Have you all heard about that model? They had a truck that came around and gave books to the community, and on there was a psychiatrist. So they were distributing books. I mean, health centers, they're so creative. Don't get me started on that again. I tried to do that this morning. But anyway, so we wrote the book, and in here, we give a lot of strategies. It's a mind, body, spirit, prevention, how to live daily lives of prevention if you want to live in health and wellness. And so we had strategies on what to do. And one of the strategies was, well, before I go there, let me tell you what motivated us. 9 million black women in midlife in this nation, of all different sizes, colors, shapes, professions, etc. What we though share are our health outcomes that are terrible. You saw this slide earlier, but look closer at it. And if you want to look at life expectancy, go on that CDC website. It is fantastic because they look at place. You can see the best place and the worst place for whatever gender, race, ethnicity you want. This is all women. So on average, we live 5 years more than men. And the Asian women are doing better than anybody. And the Hispanic women are next, Caucasian, Native American. And you can see we're on the bottom. 12 and a half years less than Asian women. I told you it was place related. The worst place for black women to live is D.C., the nation's capital. And then you saw this slide too. We're dying at rates greater than any other group of women from these major chronic illnesses all of you are seeing in large measure in your health centers. But I also want to point out the two main killers, of everybody really, is heart disease and cancer. But whenever I ask an audience, do all of you, if that's what's going to kill you, that's what your highest risk is for, you need to be really focused on what risk factors you have for these diseases. Risk factors. Okay? Risk factors, yeah, okay. So by the time we get through with them, though, they know every risk factor and they have a plan to decrease it, okay? They know about stroke, they know about diabetes. Here, if you look at Pennsylvania and D.C., talk about disparities. On the left is U.S., Pennsylvania. Look at the disparity in D.C. in terms of hypertension. Okay? So we do it with place all the time. And we're very focused on hypertension now because Dr. Levitt, the director of CDC, has made it public enemy number 2 after tobacco and contributes to 1,000 deaths per day. The thing that you really need to remember, though, is 60%, look at this, pre-hypertension is also dangerous. Look at number 3, 60% are being treated, supposed to be treated, but not controlled, okay? And women come into our program that are in some kind of medical home, and they're walking in, blood pressure's 200 over 100. Some haven't even been diagnosed, and all that's on on the CDC website. You can get those data nationally. 60% not controlled. I won't go through all that. And the fact that, of course, uncontrolled hypertension leads to all these horrible outcomes that kill you, as you know. I don't have to educate you on that. This is just showing, comparing the disparity. We always show, let me tell you this. We have learned. We started out with all these charts, these death charts. And so I said to Dr. Porter, the clinical psychologist, I said, I think this is scaring them, and maybe we need to just not do this and turn, it's too academic and all that stuff. So we stopped showing these charts and just started talking about it. But those women mobbed us after a couple of sessions. They said, where are those red bars? They said, this is what motivated me to do something. This is what motivated me to talk to my family. So now they have these charts on the refrigerator. They said, we look at this. And especially when you say most of them are preventable, we can do something about this. So you might think from time to time about actually showing your patients that you're trying to motivate and just see how it works for you all. You do know that we as black women have more obesity than being overweight. When you see on TV how they show people overweight walking down the streets of New York, and they say 66% of the U.S. population is overweight or obese. Okay, 66% are mainly overweight. The smaller percentage is obese. But as you can see from this, most of us are obese, okay, rather than overweight. We have a major problem. It starts very young in our children, and we show them the body mass index, et cetera, et cetera. And again, look at the disparity in D.C. in terms of weight, okay? All right. Type 2, oh, wait a minute, look at that one. Type 2 diabetes in D.C., look at that. No wonder D.C. is the worst place in the world to live for a black woman. Okay, so we show them, these are things we use to educate. And then we talk about, and this is what motivates them almost most of all, okay? Because as women, and also the men get motivated, but we're talking mainly to women, and we're talking to black women. And so we tell them our children, just what you heard me say, are at greatest risk, etc. So if we don't do something to start helping them to take better care of themselves. I love stories, and this is all my stories are true, by the way, except that one about the 2 women entering heaven. You figured out that wasn't true. But anyway, this is about a grandmother that joined the circle, and she had adopted her little 9-year-old grandson because her daughter had died from AIDS. And when the women come into our intervention, which is called Primetime Sister Circles, because we've chosen to use women in midlife, 40 to 75, for a number of reasons. First of all, and that's the name of the book, Primetime African American Women's Complete Guide to Midlife Health and Wellness. We chose midlife because we got their attention more than 20-year-old. They're in midlife. Everything's going south. Their weight, their blood pressure, their blood sugar, blah, blah, blah. And they're trying to figure out what to do. And they need some support, even if they're getting something to do. We also know that they're the matriarchs and the role models of their families. So if you change one midlife woman, I always wonder, if you focus helping them to change, they will change the lifestyle of their families, of their workplaces, of their churches. So changing one woman in midlife has a ripple effect. Okay. Kellogg gave us a really good grant a couple years ago to document the change from the grandmother to the change in behavior of the granddaughter. And we didn't even tell her what to do, just random. We'll just see what they do. So once the grandmothers learned it, the change in the children was remarkable in terms of their weight, their behavior change, their outcomes. It was really something to see. So now we're trying to figure out how to count, how to really document the impact in terms of numbers to market it to funders, because funders want numbers, okay? What it is. But anyway, so when they enter our program, the first thing they're told by the facilitators are, why are you here? What do you expect from the program? What do you want to accomplish? Blah, blah, blah. And invariably, most of them say their goal is to live long enough to see their great-grandchild graduate or get married. That one woman said, I have to live long enough to see my great-granddaughter get married. And she said, I've got my outfit picked up, I'm going to travel around, I know the dance I'm going to do, the boo-boo. She had it all planned. Well, she didn't even have a granddaughter, let alone a great-granddaughter. The impact of that. So anyway, this grandmother came in. She went home to her little 9-year-old son, two of them, and they're also told whoever's in your house, tell them what you're doing, so that they know that life's going to change in there in terms of eating and something. She went home and said, now, she said, baby, you're a Nana doing this program called Prime Time Circles, because I want to live long enough to see your grandchildren. He said, oh, man, that's great. So she said, you can join me when I'm exercising and we cook together, and yada, yada. He said, great. So when she learned how to really read the food label, most of the women coming in there, they try. I have physician friends that don't really know about the percent daily value and how you can really simplify it and use it. It's not as complicated as it looks. And I didn't learn that in medical school. I don't think I learned it anywhere. I learned it from all these nutrition and dietitians that we're working with, okay? After she learned it, she taught it to him. So one day they're shopping. The Doritos were on sale. She told her sisters the next week, I couldn't resist. And she got the sauce. She figured I just would take one package a week. Now, that's a killer. You never bring it into your house in any kind of quantity like that. In fact, it's strong when you get it in the house, period. So she's proud of him. He's running around the store like a 9-year-old. She's checking out. On the belt, she has Doritos. So he said, man, what in the world? What is this? She said, they're Doritos. And he said, I know they're Doritos. Do you see all this fat? And all this salt that's in here? And they're only talking about 5 Doritos. So she really talking about Doritos. He gave them all back to the case. She said, no, my Nana's not taking these because she's going to live long enough to see my grandchildren. Isn't that great? So that motivates them. That motivates them to really begin. That's a powerful motivator. Now, as you saw me do, we both combine very much the poetry, we add music, all this other stuff. And so this is a poem. I don't know if I have time to do this. Well, I can't find it. About stress. And she talks a lot about, this is a big CDC study. They had 11 million people in this study. The object of the study was to see if where you lived influenced your negative mood. Negative mood was depression, stress, anger, being bored, panic attacks, all that. It was just globbed together. 11 million people. And look at the results. Best for the Caucasian men, you're not surprised. Best for Caucasian women, African. And of course, the black women have the most negative mood. It's so funny. My white friends said, well, they do better because they put all their stress on everybody else. We said, we need to learn how to do that. Because indeed, if it's working for them, we need to figure out how to do that. And as you know, stress, depression, and anxiety, especially stress. And that's why I wanted to focus on that with you all. Because these are a major risk factor for hypertension, heart disease, all these chronic illnesses, emotional eating, obesity, aging. I want you to see this one. This was a study done at Hopkins. Dr. Porter was at Hopkins when this study came out. This is a very important study looking at depression and cardiac mortality. This is real important because so many of our women, I don't know if other women do it as much as our women, But, we say, well, we're not really depressed. We just need to pray. They'll frequently go to their ministers. They'll deny it. Their friends will say, no, you're going to be okay. Don't worry. You're not really depressed. You just need to rest. All these things. So they're not only, some of them keep a secret. They don't even talk about it. Okay? So when we show the impact of untreated depression, it's amazing. So you can see here, these were cardiac patients. Okay? So you can see minor depression increased their risk of having a cardiac death by 1.5. Untreated, minor depression. Untreated, major depression increased 3 times. Okay, you with me? These are non-cardiac patients that they evaluate. Remember, this is Hopkins, and this has been repeated at least 2 different other places. And in fact, these results are what have changed, and you all probably know this, that you really have to screen for depression. And I think all the primary things is based on these data right here. But look, non-cardiac patients, look at that. It's the same as cardiac patients as untreated, but major depression is even worse without any cardiac risk factors. CDC, this is another thing that gets their attention. CDC determined a few years ago the determinants of health. And, they said heredity was linked for these chronic illnesses. Here's environment, medical care. And look at lifestyle, though. And that's what people, most of what's going to deal with inflammation, what's going to deal with the beginning of all these chronic illnesses you're dealing with are your lifestyle. And women understand that. They put this pie chart up there, too. Okay? And I showed this slide earlier about how many are preventable. So the Primetime Sister Circle is a holistic support group, women 40 to 75, community-based. We spend a lot of time working with curriculum experts, health educational experts, to make all of our materials are community-based, culturally competent. We also deal with the levels of health literacy. One of the best compliments we ever received was at the end of a program when both Dr. Porter and I had time to go to it and see them celebrate. It's not the end, but the end of the first 3 months. It's a 3-month program. But these women, we follow them. We've got amount of data at 6 months, amount of data at 1 year, amount of data at 2 years. We're trying to get it on out. Because most of these circles, they never stop. They're still doing it. They're not coming weekly, but they go, they're not gathering weekly, but they're gathering maybe monthly. And what they say all the time is, I've shared things with my sisters in this that I've never shared with anybody in my family. And said they're going to be with me until I die. So the support, I've been surprised in the intimacy and the support of going through health behavior changes together. Because not only do they provide support for one another, they hold each other accountable. Okay? So, like all of us, we do the same thing. We're all trying to change our behavior. Everybody in this room is trying to improve. I hope you are trying to improve something. But it's very difficult. It's very difficult to get these habits of health, especially at our age. But nevertheless, well, I'll take my age, to change habits of disease to habits of health. But when you get support and people help you when you slip back or you start making excuses or whatever, all the things we do, they say, well, now, wait a minute. Just wait a minute, okay? And in fact, that grandmother I told you about, she couldn't wait to tell her sisters what her grandson had done and what her response was. Because she knew that if she had overridden him and bought the things anyway, they would have been on her case even worse than him. Question. I'm sorry?
How do people come to join the support?
Well, they either, sometimes, of course it's dependent on money. I've really learned about the nonprofit world. I had never worked in the nonprofit world before. In terms of on the other side of the fence. I was always involved with giving the money, giving grants, et cetera, et cetera. So I've never been on the side of the fence where I'm trying to get the money, et cetera. Okay. So I understand what you all are going through even more as a result of this experience. So when we have a grant, then
We do active recruiting through media. We're frequently on the TV stations there in D.C. It's easy to do. But now we're in 8 states. I'll show you that. But we're asking for people to volunteer, to be interested, have a reason for coming, that they want, if they're not motivated from the outset, okay? And also the circles are based on 3 theories of change. And the one is the trans-theoretical, based on all the changes that people go through to really make behavior change. But if they don't come in with some semblance of I'm ready to change, then that's a problem, okay? And we say maybe it's just not the right time for you to do this. So they come in, they volunteer. And also we actively recruit in churches. We go to where the women are. Nobody comes to us. We don't have a facility that's stationary. We rent space, but that's administrative. So all the circles are out in the community. The women choose the days they want the circle, the time they want it, the place in conjunction with us, so that they're really in charge of their circle. Even though we have facilitators, we have experts in nutrition, stress management. We're adding an expert in hypertension now because we're so focused on that now, because the blood pressure of so many of our women are so out of control. But anyway, so does that answer your question? Okay. So it's 13 weeks initially. That's the curriculum. Each week is different. The topic is different. But again, we stay in touch with them. We have a database. We've done over 3,000 women now. We have a database with all those women. So we're in touch with them electronically. We keep them up, the website, all that. Okay? And now we have, because so many women said, it's time for me to have another circle. I need to get refreshed. So now we have the basic circle, which is PTSD 101, but now we have 201. So we take nutrition to another level, the fitness, etc. We also have circles that are tailored to meet certain needs. For instance, a major organization that deals with health services for children, and they deal with the parents and trying to get health services for retarded kids, etc. And they came to us and said, our families are so stressed. Please help them deal with it. So we have a curriculum that's just for stress management on it. It does all the basic stuff, but it highlights stress management for caregivers, okay? And now we have a joint proposal we put into Corey with Temple University, because they came to us, because again, they have this hypertension problem, and so many of their black women that have heart failure, okay? And they said, we can't change their behavior, they're not cooperating, and so we're going to be the program that helps them really make some behavior change and understand what's going on with them. And they just said, we're too busy to deal with all that, even our nurse practitioners, etc. So we need some help. So we hope that PCORA will fund it. Focus on prevention and behavior change. It's evidence-based, and within 3 months, the literature varies for how long does it take to change a habit, because that's what we're focused on them doing. Okay, they really see how to change it, and it varies from 6 weeks to 3 months. Well, in 3 months, our women have changed at least one habit. Okay, question. We work very closely. Every time we go into a new community, we work with health centers. Okay? Now, still mainly, they are mainly providing sometimes space to do it. They do the backup referral for women that still come in and they're not in a medical home. And also lab work that we might want, so they help with that. But now we're starting to get a big proposal with the NIH with Hopkins as the lead. The point of this one is a really important one for us, because we're trying to document that we can take, and we're using Unity, health here, the health centers in DC. We work with Unity from the very beginning, in terms of we have a great partnership. You know I'm going to work with health centers. So every place we go,
enhance their control of hypertension. Because we know primary care practices are so busy, especially health centers. I mean, we got folks rolling through there. And so it's hard for them to do, when we do role play, we have a lot of intense work that we do with the women. They all look at over time. They break down, we start with 25 to 30, but then they break into groups of 5. So where they look at their own, what are their barriers to being more active? What really keeps you? And then they explore those with the experts, facilitators. Every now and then we'll have a mental health expert come in, etc. So we do a lot of things. Behavior change is hard. I don't need to tell you that. So anyway, I mentioned that. We use the book. We have the curriculum that's professionally designed, the facilitators, co-facilitators. We're in 8 states at this point. We've gotten some really national, you all need to know about this award. First of all, we got the Johnson & Johnson's first Women's Health Leadership Award. But the Purpose Prize, okay, you should start looking the first of the year on Encores. The old name is Civic Ventures. This is an organization, it's not called Encore. It's associated, it's out of Stanford, right here in California. Maybe you know about it. And their mission is to help us as a country quit throwing away people 60 and older. Because these people have had careers, and they're supposed to set superintendents of schools, and yada, yada, yada. And so they started back in 2006 giving an award, a major award, $100,000 for this award. And they give 5 a year. So you don't need to know about it. So whoever applies needs to be at least 60. Okay? And you don't have to deal, your clients don't have to be that old, but whoever's getting the award has to be an older person that's having an encore career, like I'm doing, okay? So somebody, and you have to be nominated by somebody, you can't just say, so the first year, there were 1,500 nominations, and every year it's very competitive. Somebody nominated us, we didn't even know about it, and all of a sudden we got this call, you've been nominated, and we want to come and do a site visit, blah, blah, blah. Anyway, we were one of the top 5. We won the prize that year, because we were both over 60 and even doing work with older women. So that was very attractive. But look for the Encore Purpose Prize, because it gives you a lot. They give you a amount of publicity so you can generate even more money, etc. But that threw us into the echelon of social innovators, and so we had an audience with the president, because he was dealing with social innovators. And what they did at the White House was bring the Purpose Prize winners in with a whole bunch of funders who were looking for good projects to fund. So that was like heaven. We've had the University of Edinburgh acknowledge us as an international program for behavior change. We're designated by SAMHSA as a model for training community organizations. Okay? So this was a little hungry. Let me give you some results real quick. Now, these are very simplified because we show this, like I told you, we show everything to our women. And they love the results. They love it. So this is pre and post, yellow's post. So prioritizing their health, we as women have that as a major issue. But if you don't deal with how to prioritize your health and deal with the emotions tied up in it, feeling guilty, feeling selfish, our religions don't teach that. So we're going against everything. So it's hard emotionally, and even on a religious level, to say, well, I'm going to take care of myself and okay? We help with all that in terms of the barrier. So you can see when they came in, only 30% thought they were doing it. When they left, 75% were prioritizing their health. Here's the stress level. You see the drop there? This is just a quick little thing on funders, the foundations, and then public organization. This is quick in terms of, this is fast food. 50% were eating fast food. He said, do you eat fast food almost every day? Now this is revealing. Almost every day, okay? And it got down to that, almost every day. The weight control, the portion control improved. The salt intake
went way down. So, and this is exercise. You know, black women are the most inactive people in the country in terms of activity. But as a nation, even though it's improved, we're still really inactive. And we're not really doing the 150 hours per week that's recommended. And this is the curriculum satisfaction. This is the weight change. This is not percentage here. These are actual pounds. So the 68% of the women lost weight, 68%. Average weight loss of that 68% was around 5 to 6. But the range was from no weight loss to upwards of 25 pounds. So there was a big range of weight loss. And here's the hypertension. Look at this. 50% of the women come in with hypertension. This is just 3 months now. It's even better, 60 pounds. But you can see it was down to 22%, 30% drop in hypertension. And one of the reasons, I don't know if you all the health centers are teaching your women with hypertension to monitor their own pressures. Are you all doing that? You know? Hello? You're saying yes? Great. Huh? Well, see, that's another thing, is how you do it. We spend a lot of time teaching them. The facilitators monitor it. We have professionals come in initially to teach them from the health centers, blah, blah, blah. And then they keep a record of it that gets monitored every now and then. The best thing is, and the reason, because this drop, we've always seen a drop in blood pressure. But see, this was when we were bringing in like Unity to take blood pressures, and we weren't teaching the women. This is after we had done 2 years about teaching them, okay? And we said, what's the difference? Why do you think this is happening? And the best statement one of the women made, and I'll agree, she said, this activity, first of all, we didn't know we had under control of monitoring our blood pressure. That this empowered us. This really empowered us. And it gave us ownership. That's the word. That's the word we're trying to get to. We want them to not only be motivated, we want them to take ownership of their health. And the reason that worked was because they said, we knew if we ate it was up the next day, and I had a high salt dinner. It's that simple. They said, yeah. If I don't exercise for a week, so anyway, involving them on that level and involving them with this kind of data, I just think this is important for y'all to hear. That, and maybe even if somehow the data could come off and individuals could see their own data, over time. I just think we need to do more with showing them what we're looking at. This is why we're concerned. Bam. We have to help you do that. And this is why we're so worried. You know what I'm saying? And even though it might sound academic, it might not work for everybody, it probably won't. But I'm just saying, and then also we get a little competition going between certain centers. Who did the best with weight loss? Who did the best? And I see you, and I know you all do that with your regions or within regions. You all have some little competitive stuff going on between your health centers. I think that's a good idea. It's healthy, it's fun, and then you can share why are you doing better? What are you doing? So that everybody can improve. This was return on investment. I just wanted to show you this too. That we had John Hopkins study over a 3-year period of time, medical care costs, the sick days, higher wages, hospitalizations, the unusual stuff, to document our return on investment. And what it says down here was for the health impacts persist for 3 years after we get them really involved with the circle. And the return investment for each dollar spent ranged from $2 for each dollar, so you can at least double your thing, or 9, it'll go up 9 times, okay? So we love that. So again, I just hope you all are dealing with these things. You saw these before. And then at the end, but we give them strategies, and they learn. People come in and they know what they should be doing. The issue is how. And if you don't take the time to really give them the skill, and see, that's what the fitness people do too. I mean, they really teach them how to get fit, how to use the rubber clays, all that stuff. What a trainer does. And trainers are expensive. But I've learned a lot. And also, let me just say too, one of the things that happens, and we have focus groups because we do anything. We now have a curriculum for all women. We're doing a curriculum now because our younger women said, why don't you just start at 40? So they didn't know. But brothers want, they want brother circles. No, never man they can do that. He said, no, they don't do it. They don't have pictures like you. We're like, what are you talking about? But anyway, midnight rain. I missed the point. What was I talking about before I talked about the brother circles and all that? Changing the curriculum.
Reducing the age or.
Yeah.
For younger women.
Yeah, so we're adapting to different groups, okay? Oh, I know, I'm saying we do focus groups. Before we do anything, we have focus groups for this book. So focus groups, they inform how this book developed, what's in it, how it's laid out. In fact, they wanted a diary. They wanted to write their results in their book. They wanted, okay, that's what the book does for them. And they said they wanted one that was just for black women. They didn't want one that was in, because if you look at Our Bodies, Ourselves, or any of the other books, they're good books. But they might have, they don't have chapters that deals with each, different group in terms of race and ethnicity. I remember Oprah had a wonderful program, I'll never forget this. She had a wonderful program on heart disease in women, okay, which was great. There was nothing on the difference in terms of black women and our heart disease, nothing. So I wrote a memo, real heavy. And I love her, I admire her, I respect her. This was just, a way to say, can I make a suggestion? I hope you make this annual, that you do it like every year in heart disease month is heart disease. And why not have an Asian woman, and also her consultant was a white woman. I said, have different consultants. Have a cardiologist that's a black woman, an Asian woman, Hispanic woman, yada, yada, yada. Didn't hear a word. Uh-oh, I sent it again. No. So anyway, that's where we are.